Psychological Services in the Bariatric Surgery Program. Hello, my name is Dr. Elizabeth Wilson. I'm a clinical psychologist at the Hines VA, and I'm going to be talking about psychological services in the Bariatric Surgery Program. Before I begin, I want to ask you all a question. Why are you here today? No need to answer this out loud or write anything down. Just consider for yourself. What do I hope surgery will change in my life? What do I want to be different after surgery? Perhaps you want to move easier in your body, or have to take fewer medications, or manage fewer medical conditions, or even just have more energy to spend time with your loved ones and family. Now, while surgery is a tool to lose weight, these non-weight goals are what can keep you motivated to live a healthier lifestyle over the long run, whether you have surgery or not. I want you to keep these in mind throughout the presentation today and as you move along your journey. In this presentation, I will be covering some background on overweight and obesity management. Then I'll talk about psychology and the bariatric surgery program. And then we'll spend some time discussing surgery and your mental health. First, I want to provide some background on overweight and obesities. Overweight and obesity, the contributors and potential causes. Our weight is influenced by many factors, whether these are biological, so things like our genetics or family history, stress and poor sleep, even medications that we take. Some of these factors are social. Now, this might be where you live, whether there's good space to have exercise, or a lot of fast food and other things in your environment. And some of these factors are behavioral. These are things like our eating patterns and how we choose to be active or not. Now, as a psychologist, I help people focus on what they can control to improve their health, like those behavioral factors. But I think it's also important to remove any blame and stigma that we have around obesity and overweight, because it is such a complex condition. If you're watching this presentation, it's likely because you see your weight as a problem. Now, it's helpful to have a few key points about managing overweight and obesity. These are chronic conditions, but they are treatable. However, it's important to remember they're not like a broken bone, something that can be fixed and then left alone. Instead, they require lifelong management, just like other chronic conditions such as diabetes. That means we can manage them, but we don't cure them. So, just like you might need to do regular maintenance to keep a car running well, getting your oil changed, checking your tire pressure, you also need to do things to take care of your body, like regular exercise and a healthy diet, even after losing weight. There are a range of options for managing weight, but they all include diet and exercise as the foundation. These are tools that you might learn in move groups or with a dietitian. They include regular physical activity that raises your heart rate, and a diet focused on lean protein, vegetables and fruit, and fewer processed carbohydrates. At VA, you might also work with a physician to try medications to lower your weight. And then, of course, there's surgery. There's no requirement that you do any of these options. It's your health, and you decide your priorities. But if your goal is to lose weight or maintain weight loss, surgery is the most effective treatment in terms of the percentage of your body weight lost and kept off over the long run. Of course, surgery still means doing those lifestyle changes of diet and exercise. Now, surgery is, like I said, very effective. You will see rapid weight loss in the first 6 to 12 months, and over the long run, keep off more weight than if you didn't have surgery at all. It also generally leads to an improvement in metabolic conditions. Those are things like type 2 diabetes and metabolic syndrome. It even increases lifespan. If you decide to pursue bariatric surgery, you will meet with a psychologist at least once. We meet with patients before surgery for an assessment, and we are also available for support pre- and post-surgery. This might include helping you make lifestyle changes to be better prepared for surgery, or to help you with challenges you face afterwards, like adjusting to a new body or sticking to the diet and exercise recommendations. Now, if you're not a patient at the Hines VA, you will still meet with a psychologist, but they will likely be at your local VA prior to surgery. The pre-surgical assessment will be a one-on-one appointment with a psychologist. Now, we have this appointment for a couple of reasons. We want to make sure that you're well prepared for surgery and in a place to make the most out of your treatment. There are several areas that impact success after surgery. These include your current and past mental health, your current and past health behaviors, like that diet and exercise we talked about, and your weight history. Also, your understanding of surgery and the bariatric lifestyle guidelines are important for your success after. After the assessment, we'll provide some information for guidance and feedback on any areas of concern or any changes we recommend that will help you meet your goals after surgery. It's helpful to know what to expect when you meet with a psychologist for a pre-bariatric surgery assessment. Like I said, our goal is to help you be as prepared as possible for surgery so that you can meet your goals. Here at Hines, we spend about 1 to 2 hours with you, and we do an interview and administer some questionnaires. We will provide our feedback and recommendations either during that assessment or at a follow-up appointment. In order for us to provide this service, you need to set aside a time when you can be present. This might be in person or VVC, but it's important that you won't be distracted or interrupted during the assessment. And because our goal is to give you the most helpful recommendations, it's important to be open and honest with us. Our recommendations and suggestions are for your benefit. In addition to asking questions about you, we'll talk about what you know about the surgery and the bariatric lifestyle guidelines. This includes you describing what is done in the surgery itself and what you know about the lifestyle changes after surgery, as well as what you hope will change with surgery and any potential risks of surgery. The presentation today provides all of that information, but I also encourage you to ask questions in move groups, talk to your providers, and learn from others who have gone through the process. Now, if you're a good candidate for surgery from a psychological perspective, we would expect you to display most of the strengths on this slide. That means being engaged in those lifestyle changes, being in a generally stable place with your emotional and mental health, having good coping skills, and being consistent with medical regimens and medications. Also having a stable home situation, good social support, and not currently misusing any substances. On the other hand, if any of these concerns are present, we'll work with you to identify steps to improve your chance of success and be ready for surgery. Our goal here is not to stop you from having surgery, but rather make sure you're prepared for it and get the most out of it. Sometimes slowing down the process at the beginning pays off in the long run. It's important to know that bariatric surgery and weight loss do not only affect your physical health. There are several potential risks and benefits from a psychological perspective as well. While most people experience no problems after surgery, or even notice an improvement in their mental health conditions, there are some potential risks. Often surgery and weight loss that follows improves self-esteem and body image. However, some studies suggest that after bariatric surgery, there is a risk of increased problems with alcohol, especially for people who've had a family history of this or they themselves have struggled. There's also a potential for an increased suicide risk after surgery, and there is a potential change in mood or anxiety symptoms. So because we cannot know exactly how your experience will be after surgery, it's important to know that these things are possible and to make plans for how you'll get support if you need it. This might be setting up additional appointments with psychology after surgery, or even just making a plan for how to boost your mood and cope with any changes that you experience. When it comes to adjusting after surgery, it's important to know that some parts of the recovery process can be uncomfortable and require adjusting to a new body and new relationship to food. This might even involve grieving the ways you used to eat and what food might have meant to you. For instance, if food was something you did to have fun or let loose, it'll be important to find healthy swaps to turn to instead of other substances or problematic behaviors like over shopping or drinking. It's also important that you understand that surgery will not dramatically change your life, even if you lose a significant amount of weight. It's also important to think about the people in your life. Those around you can have a big impact on your success and adjustment after surgery. Focus on relationships where you feel supported in that pursuit of a healthy lifestyle. Some people find support groups helpful. Also, psychology can offer tools for navigating social situations that may be tricky in this lifestyle change. Here are some resources where you can get additional support. There may be MOVE program classes at your local VA, or interventions with social work or health behavior change groups at your local VA. You can also reach out to an individual MOVE team member, the mental health intake center at your VA, or your embedded behavioral health team member with primary care. And finally, you can always call the Veterans Crisis Line if you're in distress. That's 988, option 1.